So thanks for joining us this evening. I'm joined by the Head of Admissions for Nursing and Midwifery, Caroline Sargison, who will be taking you through the presentation, and we will be able to answer questions in the Q&A. So any questions you have, if you put them in the Q&A, we'll answer them all at the end. So off we go. What we're going to be looking at tonight is applying to university for nursing and midwifery. And as I said, we're joined by Dr. Caroline Sargison, who's the head of student recruitment for nursing and midwifery at Middlesex University.
Thank you, Natalie, and welcome everybody, and thank you for coming to see us today. I'm hoping that we're going to cover most of the things that people get worried about or anxious about or want to know more about. But obviously, if we don't, then please, put your questions in and we will get to those. So my role at the university is I am an adult nurse. I'm a nursing lecturer, but my main responsibility is managing our recruitment processes. So I can advise on most stages of the procedure, and I do have an insight into the nursing programme as well. So these are some of the things we're going to be looking at. We will look at our entry requirements, about how to apply. Lots of students, when they come along to their interviews, ask us questions about our placements and how we manage those. So we'll give you a bit of information about that. Some further information about your personal statement and some do's and don'ts, and then also about how we help you to prepare for your interview with us. The Nursing and Midwifery Council are very clear. They validate our nursing programme, and they state that all nursing and midwifery interviews have to have a face-to-face element. So we do that as a Zoom interview, and we are carrying on doing an online Zoom interview as well for this year's intake. We have one intake a year, and that's in September. So we're getting busy to preparing our students to start in September. So our interviews have started, but we're still open for applications. Natalie, can we have entry requirements, please? So for both nursing and midwifery, the entry requirements are the same. We're looking for 112 tariff points from A-levels, BTEC, Access, T-levels, Cash. International applications, we'll look at qualifications studied abroad. We don't ask for science, and we don't ask for specific A-levels. We just want you to meet the tariff. We do need you to have level 2 maths and English, and we'll take key skills, functional skills, or GCSEs, or qualifications if you've studied previously abroad and they are comparable with ours. And as I said, once you're shortlisted, you will then be invited to book an interview with us. Next slide, please, Natalie. So I hope you can see this clearly, but these are some of the placements that we use for our nursing and midwifery students. We will allocate you to one particular trust where possible, but you may have to visit other trusts to get different experience. So the main trusts that we have are the Whittington Hospital, the Royal Free, the North Mid, Barnet and Chase Farm, but we also have placements at the Royal National Orthopaedic Hospital. And for midwifery, we have some placements at Queen's in Romford and Whipps Cross. For mental health, we have Barnet Enfield and Haringey Trust and Camden and Islington NHS Foundation Trust. So one of the big decisions you need to make when you're applying to do nursing is it's not about travelling to come to the university, it's about travelling to get to placements, because you'll need to be there sometimes very early in the morning, weekends, you're travelling home late at night. So using the TfL, Transport for London website, is a very good start to look at, can you get to placements? Often there's no car parking or it's very expensive. So you'll have to be looking at public transport a lot of the time. The only exception to that I know of is the Royal National Orthopaedic Hospital at Stanmore. I think they have very good car parking. Next slide, please. So when you're looking at your nursing application, some people think, well, if I apply for everything, I'm bound to get into one of them. That's really not the case. So you need to do your work before you submit your application form. What is it you're interested in? Look at what is involved in that career. So the NHS Careers website is really helpful. Do you know what you're going to be doing once you qualify? You might not, and that's fine, but think about where your career may lead you. So do you want to look after children? Are you interested in mental health? Do you want to be a midwife? But you need to understand what's going to be involved in that. Now, with all the fields of nursing and with midwifery, there's quite a crossover. So for children's nursing, you're going to have some mental health placements involved in that. You're going to be looking after children who do have some mental health issues. Likewise, if you're doing mental health nursing, some of your patients will require nursing care. They might be frail, they might be old, they might have got addiction problems. And also, if you're working in adult nursing, then you're going to have patients you're caring for who've got mental health problems as well. So there is some crossover, but your particular specialty, you need to decide before you submit your UCAS application. Don't apply for more than one program. You can apply for 5 different universities, but be very clear about what it is you're applying for, because your personal statement needs to reflect your understanding. So your knowledge of that particular course or program might have come from personal work related. You might work alongside nurses, you might work in a particular group of people like children or young people. So think about that, talk to people you work with, see if they can offer you any advice as well. So also think about what are your personal qualities. So all these are things that you're going to bring along to your personal statement, but also along to your interview. Would you make a good nurse or a midwife? Do you communicate well? And communication, one of the key things in nursing midwifery is listening, because listening is the most important part of communication, as well as looking at your non-verbal signs. Do you have genuine compassion for people? Do you care for people? We don't want the people that are looking after our most vulnerable people in society to not be compassionate and caring. Do you like people? Have you had experience of working in a customer facing role, such as bar work or waitressing, shop work? Have you dealt with people in different situations as part of a team? Are you motivated, committed, and enthusiastic? Because sometimes when you're studying to be a nurse or a midwife, you'll find that it is quite hard work and your motivation may struggle. So you've got to be really sure that this is what you want to do, that this is definitely the career you've chosen. You're going to be working with a diverse group of people, both as your colleagues and as your clients and patients. So you need to understand what we mean by diversity and equality. And equality isn't about treating everybody the same. That's definitely not what it's about, but it's making sure that everybody has equal opportunities. So how do we provide that as healthcare professionals? Can you use your own initiative, but also are you good at working in a team? Are you willing to learn and take feedback? Because sometimes, feedback can be difficult and painful, but we need it. Also, are you reliable? Because when you're out in your clinical placements, you have to be there on time. They can't hold up a shift waiting for you to turn up. So you need to be dedicated, reliable, and have good timekeeping. One of the major parts of being a nurse or a midwife is problem solving. So if you're good at that and that's what you like, this is definitely the career for you. I've always enjoyed problem solving, and I like looking at all the different aspects of it. The issue often with nursing and midwifery, there aren't any simple solutions, but you're looking at the best outcome, and that's often a team decision. And sometimes it might not be what you agree with. You might not agree with the decisions that are made, but you need to be able to deal with that. Also, it is a stressful job. The rewards are great, but sometimes it can be very difficult. You're dealing with people who may not improve, who may not get better. How are you going to manage that? We will help you, and so will your colleagues, but you need to be aware that it's going to be stressful. And also you need to be confident, because you need to feel able to ask questions. You can't just accept all that's happening around with you. Sometimes people are quietly confident. There's nothing wrong with that, but you need to be able to ask questions when it's important. Next slide, please. So for those of you that have not started personal statements yet or are still writing them, I'd like to assure you that we do read them. Your personal statements are read, and they're read by people, the academic staff, when they are interviewing you. They're read at shortlisting stage by me. So they are important. And also I think it's a good way for you to get your thoughts in order and get them down on paper. So start early. Don't leave it to the last minute. You might have to do several drafts. Sometimes it's easy just to put the whole thing down on paper and then edit it. So you've got a bulk to start with, and then start taking out what you think might not be necessary. Be honest. There's nothing wrong with honesty. Your experience is relevant, but don't just focus on, people get very hung up on writing about clinical experience. Your academic experience is just as important. Your course is 50% theory, 50% clinical practice. So make sure you talk about your academic work as well. It's good to see some enthusiasm and interest in what you're doing. It may be you've got a particular interest, such as some people from midwifery might be really interested in working with young mothers, or they might be interested in working with women who've got underlying mental health problems. That might have come from a personal experience. It might have come from working with a particular group. Show it, show your enthusiasm, show how you've developed that. Again, research what you're going to go into. Make sure you really understand it. Lots of people talk a great deal about caring, which is lovely, but caring isn't the same as nursing. So caring for somebody is what often family and friends do, but nursing and midwifery have got very specific skills that you need to be aware of, because in an emergency situation or when somebody's very unwell, you need to step up and step in and do what you need to do. Tell us about your strengths. Tell us about, where you've got this knowledge from. It might be that you've got a sport or a hobby, or you've been involved with a charity. I interviewed somebody this week who was actually in Rwanda, working for public health in Rwanda, and that's where her interest came from. And she's now realised that to get a career, she needs a nursing registration, because she wants to get involved in vaccinations. She wants to get involved in running clinics out there. And at the moment, she can't do that. So her career, as it is, has now taken a different turn, where she's going to come back to the UK and study nursing. And then eventually she'll want to go back out there and help with their healthcare. Fascinating, really interesting to meet her. But that's how she's developed her knowledge and interest in this programme. So don't make it short, because, you've got a lot to tell me. You've come to this decision. Obviously, you know what you want to do. So tell us about it. We don't want quotes, please. I don't want to hear about, Maya Angelou's or Florence Nightingale. I've read it all so many times. I don't need quotes. Don't just write lists, because the whole point about your personal statement is so what? If you tell me something, then so what? So if you tell me that you're good at working in a team, why is that relevant? You need to think about, I don't know you. I'd like to know you. This is how that I first get to know you. So make it relevant, but make it interesting. And also, please check your spelling and your grammatical errors, because it can make things read very differently if it's not grammatically correct. Thanks, Natalie. So these are some of the things we're going to be assessing during your interview with us. And I think we're quite unusual at Middlesex, because we're going to be sending you your questions in advance. So you will know what we're going to be asking you, and you will have a chance to prepare them, because we would like you to come along to your interview relaxed and ready and prepared to answer our questions. It's not a quiz. We're not trying to catch you out. We want to know about you, and we'd like you to feel that you've had the chance to reflect on you and give us perhaps examples to demonstrate your knowledge, but also to feel that you're prepared for your interview. So the big one, which people often fall down on, is about the awareness of midwifery or nursing and what they actually do. It's not enough to say that midwives deliver babies. It's not enough to say that nurses care for people. How do they do that? What are they actually involved in? And there's loads of things on YouTube. Lots of people talking about their day as a nurse or a midwife and what they're involved in. There's lots of help with things like the NHS Careers website, where people talk specifically about what they do. So people are very generous these days in sharing their knowledge. So access all that's available to you. Think about how you're going to manage the course, not just the academic aspects of it. And lots of people come along to interviews and ask me what support we're going to offer them. But if you look on our website, there's so much support available for our students, because we know it's stressful. We know it's difficult. We can't stop it being stressful, but we can help you with it, and we can support you when you are struggling. But we need to know that you've thought about how you're going to manage it. So, you could be working late, early shift, late shift. You could be dealing with a particularly difficult situation with your patients or clients. How are you going to manage that? How are you going to stop taking all that home with you, which is what we don't want you doing? Tell us about your experience of working with others. It could be projects at college or school that you've been involved in. Excuse me. You've all got experience of working as part of a team, whether it's developing a group project, or it might be a job that you do. Think about what it is that you enjoy about that, like working with other people, and sometimes what can be really difficult. So as I said, we send you a lot of information out in advance to help you get ready, to help you prepare for your interview, so you can present yourself in the best possible light. Next, please. Natalie, do you want to say anything about this, about the guide?
Yeah, I mean, this is a general guide, but when you when you get invited to interview, you'll get a link to a guide that's specific for nursing or midwifery, and it will have relevant information in there. But this is a general guide that you can scan this document. It is it's very general, so it just gives you some ideas and will help you with your interview planning and prep for it.
Yeah, so we've worked very closely to see, what it is that we're looking for from our students, and this gives you that insight. Also, if you haven't had chance, we would recommend you coming along to one of our open days. I think the next one's February, just to give you a chance to talk to us and meet our students and look at our facilities. Next one, please, Natalie. So I'm not going to go through all these, but this is just because these are all in the guide. These are just an example of some of the questions that you might be asked. So the question is, what do you think are the most important personal and professional qualities of a nurse? And one of the things we focus on is this, what's called the 6 C's of nursing. So care, compassion, competence, communication, courage, and commitment. So what I would suggest to you as an example for this question is have a look at those. And you might want to say to us, well, I think the most important of the 6 C's are these, and this is why, and this is my example that I'd like to provide. That's the level that we're looking at for your interview. Okay, so you might think communication is the most important, or one of the most important, and you might like to give us an example of when you've been involved in a situation where communication's gone really well or not gone very well. Okay, next one, please, Natalie. So we've talked about this one before, about the role of a registered nurse. What do they do? What are their roles and responsibilities? Don't just think about the clinical care, but they are often the people who are in charge of the ward. So they're managing the ward. And what does that involve? What do you think they have to do that? And also the same for a midwife. What's some of the roles that a midwife has? It's not just about being there when baby's being delivered. They have other roles and responsibilities too. Next one, please. What teamwork we've talked about. Again, think about your place in a team. Some people like to be in charge of a team. They actually genuinely enjoy being the team leader. Others like to be quiet and just listen and perhaps contribute when they feel confident and feel they have something to say. So lots of people have different roles and different responsibilities within a team, but we can't cope without them. Healthcare in nursing and midwifery is so dependent on teamwork and it being successful. But lots of organisations are aware of the need to work as a team and work well as a team. Okay, so we might ask you about prioritising your workload. How do you manage? Some of you will be studying at the moment and working. How do you manage that? What sort of things do you put in place to make sure that you are making the most of your time? It's not just about working all day and studying all night. It's about how do you manage your workload? We will be assessing your communication skills, your interpersonal skills. Don't worry if you're nervous. We're well used to interviewing people who are nervous and apprehensive when they come for their interview. That's fine. It's fine. And we'll help you and we'll prompt you and support you. Diversity, very important, as we've talked about. We like to see that you can reflect on your own experience and your life skills and bring that into the interview and talk about it. And also, again, thinking about emotional situations. You might be working in a midwifery setting with women and the baby might not survive, or you have to tell a woman that her baby's not survived. You might be working with children and they're not going to get better, and they know that, and their families know it. And each time they're readmitted, they might be a little bit more poorly. These are all things that we can't change, but we can help the people that are going through it and support them. But that doesn't mean that you're not going to have a knock-on effect from dealing with emotional situations and difficult situations. Okay, you might want to ask us questions as well. Why would you want, lots of people say, why would I want to come to Middlesex? Why should I choose your university? Well, we're very highly regarded. We're number 2 in London for nursing. We have a brand new state-of-the-art skills centre, which again is on our YouTube video, so you might want to have a look at that. You might want to ask how we can help you be successful and what support's available to help you with your learning. And some questions we get asked is about job opportunities at the end of it. Well, your whole 3 years really is an interview, because the trusts are looking to recruit you. And I would say that most of the students who want jobs get jobs with our trust. Some of them go elsewhere, some of them work internationally, some of them go to different trusts, some of them work in other parts of the country. If you've got your nursing or midwifery registration, you can do what you like with it. It's going to give you a complete future. You might not want to work in a hospital. You might want to do community work, and that's fine. Lots of students go straight from their student nurse training into community posts now without having to work in hospitals. That never used to be the case. So there's lots of job opportunities available there for you. And one of the other questions we often get asked is about preparing for the programme. And we start working with our students to enable this. We have days where we run in the university when we invite you to come in and you can meet our other students, and we start to give you some more detailed insights about what it's like to actually be a student nurse. Obviously, as I said before, open days are really important because you can come along and see what the facilities are and what we're offering you as a student, not just as a nursing or midwifery student, but as a university student, because you've got access to all the facilities the university has that are available for all our students. Next question. Okay. Oh, there we go. The next open day is on Saturday, the 24th of February. And we have campus tours. That's tomorrow, isn't it? The 17th?
Right, yeah, we've got campus tours tomorrow, and they do run every week from 4 to 5 p.m. So if you want to see the university and the facilities, you can scan that QR code and come to visit us. We're based in Hendon, very close to Hendon Central Tube Station or the mainline train station, if you're thinking of visiting us tomorrow. As Caroline just said, our next open day is on the 24th of February 2024, and closer, if you are successful at interview with us, closer to in the summer, you'll get invited to an applicant day where we prepare you. That happens in June or July. Is that correct, Caroline?
Yeah, usually June or July. We try to do it once you've had your
Because there's lots of things you need to do as a nursing student once you've accepted your place, is like your DBS, your occupational health, all of those things. So we do that just before you start the course and to prepare you with, I suppose, everything really. And if you've got any more questions and you come to the university again one final time.
Okay,
So do you have any
I don't have
questions
anything
for us?
to add to that. Has anybody got any questions they'd like to ask us? If you think of any questions after this that you wish you'd asked, if you go onto our nursing web pages on the website, you'll see me in the bottom right-hand corner. It's not a live chat, but I will get back to you. So you can ask anything you like there if you want to.
Is there any more questions? Oh, here we go.
Mm.
How do we, okay. So I'll read the questions out, Caroline. Will I be considered if one of my grades is below what the entry requirements are?
Absolutely, yes. We will look at your overall profile, including your interview and your overall results. So yes, we don't just dismiss people. We take a long time before we reject anybody.
And how will the interview take place?
They're all on Zoom.
And the students get a link and they book on their date and time, is that right?
Yeah, you can choose, we'll send you a link and you can choose when you want to come and at what time, and you click on that and that automatically books you in. If at any stage you think, oh, I can't make that, you can go back in and change it. Even on the day of interview, you can go back in and cancel it and change it and rebook it if you don't. So don't worry about that.
How long does an interview last, Caroline?
It's usually about 20 to 30 minutes.
Okay. Thank you. And then there's a question around fees. As an international student, can we pay in? You would need installments. You would need to contact the international office for the answer for that. Or if you go onto the international web pages, there'll be information around fees and finance for international students.
I left college in 2007. Diploma Technical Social. 2007 is too old. We need your level 3, so your A-level equivalent course, to be within the last 5 years. We'll take your functional skills, but I would suggest you look at studying an access course, and you can either do that at a local college or you can do it online. Learn Direct do access courses, and we accept those.
How soon after applying for UCAS would they be invited for interview?
Well, at the moment, all the shortlisting is up to date. So all the invitations have gone out. So they're normally within about 5 to 7 days. You should get your, because UCAS upload to us, and then once we get it into the system, then we start shortlisting. So they're turning around fairly quickly.
Okay, thank you.
Yes, we would definitely need you to have your camera switched on, please, for a Zoom call, because we need to know who we're interviewing. So you'll be asked to come with photo ID, so passport or driving license, and then you'll have your camera on during your interview.
Thank you. So do you accept transcripts as a requirement for the application?
It depends on what the transcript is. If it's a degree transcript, we'll also need your certificate if you've completed your qualification. So we'd accept a transcript in the meantime, but we would expect you to have your certificate at some stage. Yes, your camera does need to be on. Online qualification, is it valid? It depends on the qualification, but yes, we do take online qualifications. We take online access courses.
Yeah.
Access to Science from 2017.
I suppose what have they done since then as well?
Yeah, so we would consider it. We'd look at your overall application before we would say yes or no to something. Yes, the Access Nursing Online is valid. That's why I've said we accept it. After the interview is done, how long will it take to get back to us? We usually say within 5 working days, we'll get back to you with a decision. Sometimes it's quicker, sometimes it's short, depends on how much work the admissions team have got on, but we're very quick about getting back to you.
Yeah, it depends, doesn't it? Because obviously the equal consideration deadline is coming up, so there'll be lots more applications coming in. So it may there might be a slight delay then, maybe.
Yeah, but we try to be as responsive as possible. So, for example, I've interviewed today. All those decisions have been uploaded to admissions, and they then start checking them and getting the offers out as soon as possible.
Thank you. Is there any more questions? This recording will be shared with you afterwards anyway, so you can always listen to it back. But as Caroline has already said, we have got an open day in February if you want to come and see us, and we've got campus tours tomorrow.
Hang on. You said caring is not the same as nursing. So does that mean a role as a care assistant is not necessary experience? No, absolutely. That's not what I said. We'd obviously accept anybody who's got caring experience. So yes, please do go and get work as a care assistant. But nursing is a very specific profession, which is why you have to train for it for 3 years. So we have lots of our students who work as care assistants, who work as care assistants during their course as well. So please, yes, do go and get some experience working as a care assistant. We haven't got a closing date for the application at the moment, but do get it in as soon as possible.
Yeah, I mean, the early equal consideration date is the end of January with UCAS, but afterwards we review the applications. If we've still got spaces, then we will open for lates and extra if necessary. But really, ideally, you want to get your application in as soon as possible, is what we would say.
Does it matter if one has a 3-year gap? If you can explain your 3-year gap, no, it's not a problem.
No.
We have plenty of people who've got gaps in their CVs where they haven't been
It may
studying.
be they've been studying and then they went and got a job for 3 years, or they may have had some time off because they've had family commitments and those sorts of things. People have different lives, or they may have gone traveling and now come back to it. You just need to explain it really.
Yeah, some people wait until they're financially a bit more settled before they start their course.
Yeah.
All sorts of things. So no, that's not a problem. And also,
And
lots of our students are older and they've might be changing careers later on in life because they want to. So, we're not full of 18-year-olds who've come straight out of school. We have lots of people with different life experiences and different career pathways that have brought them here. So, that's what we enjoy. We like to see such a variety in our students. Has anybody got any other questions they'd like to ask us? Feel free. We don't mind. Ask us anything.
Yeah.
No, we don't offer a foundation course for nursing. We offer a foundation year for other subjects, and we'll take some of our students study the foundation science course, and we'll use that as entry for nursing. But we don't have a specific nursing program.
We've given you today will be sent out to you if you apply for nursing. There is quite a lot of information already on the website, and we've got a YouTube channel with lots and lots of information on around personal statements and applying through UCAS, as well as preparing for interview for nursing and midwifery. So there's lots of information on our channels as well that you can access after. Is there any more questions before we finish for the evening? One final time.
Okay, well, thank you very much for coming along.
Go on. Do expect access? Yeah, we do accept access for nursing, access to nursing and midwifery. As long as it meets the entry requirements, what Caroline went through at the start, yeah?
Yep.
What else? What's that one? It depends on what the diploma is worth in UCAS points, doesn't it?
And how old it is. If it's more than
Yeah.
5 years old, it might be a problem. But yes, if you've got any questions about that, you can either get in touch with our undergraduate. No, if it's more than 5 years, then no, I would suggest you do an access course.
Mm-hmm. Are mature students welcome? Of course they are. As long as you meet the entry requirements and you're fit to practice,
Yeah,
and you can meet DBS, then I'm sure that over 50 is fine.
yeah. Lots of our students are older, and we like the fact we have older students. Makes a good mix.
Okay. Okay, so we've answered that one. Is there any more questions before we leave for the evening?
Good. We
Okay.
like older students.
Yeah.
No, you can study nursing as an international student, but you will need to get a visa to study. But we have people who can help with that.
Yeah. You just have to pay the international fees.
Thank you.
Thank you. Are we done? Done. Thank you. Yeah. Okay. Attending online course.
Program, would you accept to do undergraduate nursing program? Yes, yes, as long as it's not more than 5 years old.
Mm-hmm.
Yes,
Yeah.
we take students attending online courses, as long as they meet our entry requirements. Now, the university will take you through the DBS process. If you have got a DBS, it's worth joining the update service.
Mm-hmm.
So if you currently hold a DBS, if you have the update service, and it makes life a lot easier when you join as a student.
Yep. Thank you.
You're welcome. You're welcome. Good luck.
Yeah. So we're gonna.
You're welcome. Keep in touch if you need us. We're all about.
Yeah. So as I say, there is the open day there, and we've got campus tours tomorrow if you want to see. But we do campus tours every week. You can find them on our website if you want more information around those. DBS is a criminal records check that all nursing and midwifery students have to do.
Yeah. So, and any student studying nursing midwifery, any university has to have a DBS.
Mm-hmm.
Yes, you can contact us. So, as I said, if you go onto the website, you'll see me in the bottom right-hand corner. If you put any questions in there, it's not live, but I will get back to you.
Yeah. So if you go to the nursing course page, you will see at the bottom on the right-hand side, a chat box pops up, and that is Caroline's chat
Yeah,
box.
you can see me, and I will get back to you.
I think. Yeah. So I think we're done. Anyway.
Oh, thank you.